Welcome back to the Senior Hour. I'm Dr. Gene Dorio with my co-host, Barbara Cochran, on your hometown station AM 1220 KHTS. We're talking now with Micheal Dougherty, who is a community rep from Henry Mayo Hospital, who also has a show here with KHTS on Mondays from 12 o'clock to 1 o'clock, Families in Action with Carrie Quasham. And, I was listening to the show on Monday, and I will tell you that I just about had to stop my car to listen to your guests. You had the parents of the Reynolds. That's
right. It was
boys.
Alice and Tom Reynolds.
Alice and Tom Reynolds were on the show, and the discussion related to the deaths of their sons here in Santa Clarita in an accident that was related to drugs. Mm-hmm. And that's what your show, Families in Action, is all about. And I think it's been about 16 years or so that that accident occurred, but for them it's still like yesterday.
Sure.
And I think you alluded and made a statement about how time helps, but it doesn't relieve the pain.
Right. Yeah,
and,
that's something Carrie said. Right.
And I just felt that it was difficult to hear, but it was poignant to make sure that especially our children, our kids here in the community who potentially could be using medication, alcohol, or drugs in any way, have to be responsible when they are doing that. And obviously it led to their deaths, but it was it was difficult as a group. You guys do a great job getting that information out. I appreciate that. I think our community certainly does that. Feels that it's helpful and has made changes and gotten kids especially off the road, but there are still occasions where we hear these things happen, and we got to keep pushing that message out there, Mike. And you're doing a great job. We appreciate that.
Well, thank you, and I'll pass that along to Carrie as well, because Carrie's been beating that drum for a lot of years.
Yep.
That's true. And I remember when those young boys died, mm-hmm. and I'm thinking, gosh, has it been 12 years ago?
It was very sad.
And I know, because I lost a son 31 years ago. And mm-hmm. the pain never goes away.
We lost our son 3 years ago.
Oh, yeah. So you know exactly what I'm talking
about. Sure do. That's a toughie. Not one you don't want to be there.
No, you don't.
But on a lighter note, you work out through Henry Mayo Hospital, and you are through other hospitals. You are able to get notes and progress notes and things like that people publish that have a little lighter side to it.
I came across these on the internet some years ago, and I thought they were funny, and I just thought it would make for a nice humorous moment here on your show.
Very good.
And now I have to say, none of these are notes that physicians write into charts. Dr. Dorio does this all the time.
Yes.
And as you can imagine, when you're in a hurry, maybe sometimes you don't write them quite the way you mean them. And so we'll see if Dr. Dorio can relate to any of these. You ready? There are 5 of them. First one, the patient is numb from the toes down.
That could have been one I wrote.
Here's the next one. The patient has no previous history of suicides. You just have to think about that for a second.
Yes, you do.
Now, this is one, Dr. Dorio, I think you'll agree with this one when I read it, that this physician sounds a little bit egotistical. Listen to this. Discharge status, alive, but without my permission.
Yeah, that is egotistic.
Alive, but without my permission.
And now, if you're a lady, you can relate to this. Just listen to this very closely. Patient stated she has been constipated for most of her life until she got a divorce.
What does that have to do with each other?
And lastly, patient refused autopsy.
Now that is hysterical. Wow. That one is patient refused autopsy.
And wise indeed.
Oh my.
We are here to talk about mental health.
Yes.
Mental health.
Could I read a short story for you?
That'll be great.
Absolutely.
Well, if you're listening out there, you want to turn up the sound on your radio. Picture this story. A widow who lived alone had been feeling depressed for some time, and she worried about it. My brain has to be well. I can accept a broken arm or a broken hip, but not a broken brain. She worried that if she was mentally ill, her life would collapse. She worried about the shame of seeing a psychiatrist. I can't go to see a psychiatrist. What would people think? And she was afraid. What if I had to go to one of those psych wards in a hospital? One of those nut houses full of crazy people? Would anyone even come to visit me? Could they visit me? So she made a decision. People who are mentally ill are the ones that cause their own problems. They did it to themselves. So my depression is my own fault, and I can feel better if I just force myself to snap out of it. Of course, this story is all too common. The good news in this case is that senior citizen got the help she needed.
Absolutely. Absolutely.
But a lot of them don't.
That's right.
Because they believe, just as you related in the story, that they think that they can get themselves through it without getting any help. And, in this day and age, Mike, people continue to do this and take that challenge, and it's good that they do, but there is help out there. There is help, and especially for our seniors who the situation of life sometimes will create the depression, as opposed to being a full-fledged mental illness. It evolves into that after a while, but you can seek help. There are people out there that will extend a hand and bring you forward in life and give you the ability to return to having good quality of life. But if you don't take that step, if you don't extend that hand, you're going to be done. So, and this is what I think we do at the hospital, you do on your show. You make sure people understand that there are people that will help you.
That's right.
So don't give up on that.
No. And as in the story, when the lady said, go to one of those psych wards in Nut House, I work in the behavioral health unit at Henry Mayo Newhall Hospital, and we are a modern facility, 23 beds, and we're for adults age 18 and up. And we have had people well into their 80s on the unit. They can't be there because of dementia or Alzheimer's as their primary diagnosis. They have to be there because they fit one of three categories. That's a state requirement. One would be suicidal with a plan, one would be homicidal, and one would be gravely disabled, which basically means you can't get through the day without assistance.
And it's sad because there are some cases of patients who have dementia some of the categories will overlap into, and they'll be denied admission into the behavioral health unit and will not be able to get that help. That's a sad situation that government and insurance companies and such they put our patients into, and our physicians and our hospital into as well. But listen, there are many more people that have clear-cut delineation that we can help, and we need to keep doing that.
Yeah, and just in case you're out there listening and you're thinking, yeah, well, really, how much does mental health problems affect seniors? Well, more than 2 million of the 34 million American aged 65 and older suffer from some form of depression. There's a lot. Symptoms of clinical depression can be triggered by chronic diseases common in later life, like Alzheimer's disease, which you were just talking about, Parkinson's, heart disease, cancer, and arthritis, just to name a few.
Oh, yes.
There are a lot of things. And another one is widowhood. 1/3 of widows or widowers meet the criteria for depression in the first month after the death of their spouse, and half of those individuals remain clinically depressed after 1 year. They just can't quite get over it. And it's not a matter of them just being down. They are clinically depressed, and they can't pull themselves out of it by themselves.
That's right.
How do their loved ones recognize that, though? We were talking earlier about Alzheimer's and trying to recognize memory problems and when one might start exhibiting those problems. But clinical depression, and we commonly see that in our elder seniors, it is a major problem in our country, and it many times is situational. We start feeling older, we start moving slower, we have those chronic diseases, we're taking lots of medications. Plus, in addition to that, we're always worried, where are we going to live? Can we continue to pay for our home, our taxes, or live in the situation we have? Seniors don't like change, and all of a sudden they're facing not only a physical problem but a locational problem too in their own health. So how do the caregivers start to look at their loved ones and say, "Ooh, could my mom, my dad be having depression?"
Well, Dr. Dorio, you bring up a very important topic, because one of the things that happens with seniors, well, there's two things that are really going on. Number one, most seniors think that depression is actually a part of growing older.
Of growing old, that's very true.
That it's common, it's normal. So they don't think anything about it. Okay, I'm depressed, but hey, that just comes with the territory.
Yes.
That is completely false.
Yes.
Depression is a serious illness and should be taken care of no matter what your age. The second part of that is that besides seniors being silent about it, family members don't pick up on it because they don't understand it. And if the senior says to them, "I'm feeling down," very, very often their family members or friends will say, "Well, you'll be okay. You're just down. Just pick yourself up. Take a shower, take a bath, go out, work in your garden. You'll be fine."
And they don't understand that is easier said than done.
Right. Well, it's impossible. If you're actually clinically depressed, you can't do that. You need help.
Or if they do it and they still are depressed.
Exactly.
And many people do try to yank themselves out of it and find that they can't.
And then the other thing that takes place, and with all respect to you, Dr. Dorio, as you well know, general practice physicians miss way more than half
Easily.
of clinical diagnosis for mental illnesses. And it's not that's not saying anything negative about doctors. That's just saying that's not their specialty. And what happens is most seniors just go to see their general physician about it. "I'm down, I may be depressed." Well, it gets misdiagnosed. So there are really three things going on. But yes, it's very, very important for family members and friends to know what to look for. And the signs are really obvious once you start connecting the dots. And they are simply, first of all, somebody that's down for more than 2 weeks. You can have a bad day, you can be blue for a while, but if you're down for more than 2 weeks, it's starting to look like clinical depression.
When you say down, though,
a blue mood,
right.
I just...
isolating yourself, staying at home, not even watching television, not talking to people, not turning the TV on, or not answering the phone. These are the things when you're down, you're down and out.
You are.
And that contact and communication is lost.
And you can also, you will generally have a change of sleeping habits. You could either be sleeping a lot. Woody Allen once said, one of the good things about depression is you get caught up on your sleep. But it can also work the other way. You could actually not be getting very much sleep. And it also a change in your eating habits. But yeah, you're right, Dr. Dorio. You get to the point where you're just not interested in things anymore. And things that you loved, like perhaps taking care of your plants, all of a sudden you just don't want to do it. So it gets very pronounced. And when people see that, they need to not just gloss it over and say, "Oh, they're just going through a phase." No, they're not a teenager and they're not going through a phase.
And there are some people that go through life, they do great. In the LA Times today, there's a part 2 section. There's a story about a woman celebrating her 100th birthday, and her husband is standing next to her, and he's 102, and they're celebrating like their 67th wedding anniversary coming up, something like that. And but I think one of them said, we've always had something to do, we've always had purpose, and that's great for a lot of people to get through life, but not everybody can do that. They've had each other for all these years, but like you said, Mike, people lose their spouse, they lose sometimes their kids, sometimes they lose their job or feel their worth is gone, and all of a sudden their physical health problems are overwhelming them, and then the mental problems start to set in.
That's true. And here's another thing that people need to pay attention to. Older patients with symptoms of depression have roughly 50% higher health care costs than non-depressed seniors. So being depressed not only kind of ruins your day, if you will, but it's going to cost you if you don't get it taken care of. Because if you get ill, it's going to take it, not only is it going to be more expensive, but it's going to take longer for you to get well.
That's right.
And here's the problem. We were talking about some of the primary care physicians especially not seeing the psychologic problems that our seniors face. When you see your doctor these days, you're there for 10 minutes. You're barely taking your sweater off, you're barely, getting your blood pressure done, and it's, how do you feel? I feel fine. You're out the door.
That's right.
And in the past, when I was going into medicine, that connection between the psychological side of life versus the physical side, doctors nowadays are just treating the physical side. How much medication can I give you? Here's another prescription. This is what's going on. It's to take care of the physical side, and certainly we can throw a drug at a person and say, oh yeah, they're depressed, and give them this. But that's not solving the underlying problems that are going on with their seniors. So as we look at the picture, we want to look at the physical picture and the psychological picture as we try to attempt to pull people out from being down and bring them back up again.
And I'm sorry.
Just an aside, with Eugene being a doctor who makes home calls, you have a distinct advantage.
Absolutely.
You really do, because you are there in the home with the patient. You notice the surroundings, everything around, and that gives you a much better clue as to what's going on with that patient, rather than having him or her visit you in your office.
Makes a huge difference, because if have been seeing them and I go to their home and I'm seeing now more disarray in the home, I'm seeing more dishes in the sink, an empty refrigerator, the pets aren't being taken care of, the laundry building up, all of this gives me a clue that I can address immediately to the family and even to the patient. So yes, it
really makes a big difference.
It makes a huge difference.
And it's unfortunate that doctors don't do that anymore.
Do house calls.
That's true.
Yeah,
we need way more physicians, not just in Santa Clarita, but across the country, primary care people going out to make these house calls and see where our seniors live. But I don't see that in the foreseeable future. I'm hoping that it will happen, and we're forcing the issues here in Santa Clarita, trying to get more doctors to do it. But there's no doubt better care will be rendered if we can get people seen in this way.
That's true. Well, I can remember my doctor when I was a little girl in England. His name was Dr. Lobo, and he was Indian. He came in with his turban on, and I had whooping cough at the time, and I was miserable because back then they didn't have shots to help prevent whooping cough and chicken pox and measles and all of that. So I got all of those diseases when I was a little girl. But the doctor always came to see me, came into the home, came into my bedroom while I was in bed. And they don't do that anymore.
No, they don't. No. My mother had a memory that she told me a long time ago. She said, I remember the doctor coming to the house with a little black bag, and my mom was expecting my younger brother. Then when he left, I had a younger brother, and I asked my mom where the younger brother came from, and she said the doctor brought him in a little black bag.
That is wonderful. But that memory will stay with you.
It has.
Oh yes, never will leave you. Just like the visit I had from my Dr. Lobo. It was incredible. And is it time to take a break?
Yep.
Yes, it is. I'm Barbara Cochran with my co-host, Dr. Jean Dorio, on your hometown station, AM 1220 KHTS. Welcome back to the Senior Hour. I'm Barbara Cochran with my co-host, Dr. Jean Dorio, on your hometown station, AM 1220 KHTS. And we're speaking with Mike Dougherty, who's the Community Relations Rep for Henry Mayo Hospital. And we've been talking about a variety of things.
Well, I'm specifically with the Behavioral Health Unit.
Yes.
And we are there to serve the community, 18 years of age and up, and that includes seniors. We are there. One of the easy ways for people to find out if they need to be in that unit is if they end up in our emergency department, they will not only be seen medically, but they will also be seen by a mental health specialist who will be able to ask them a lot of questions. And at the very least, if they're not going to go into the unit, at the very least, they will leave with a lot of resources. They'll be able to tell them where they can go to get some help, whether that's groups that they may need to get together with or some kind of outside therapy. But we're going to take care of them.
And I think that's the biggest fear for our seniors is that their mental health and their fear they're going to be put somewhere institutionalized and their freedoms will be gone, and that just isn't true. Though you need to make sure your mental health is worthy, as you talked about. If you don't, not only does it cost more money to help support you and your problems, but it also takes a toll on one emotionally and the family as well. So seek that help. For our seniors who are listening right now, this is to recognize the problems that you might have mentally. You do that, you can move forward, and you can move forward physically as well, but don't ignore it.
No, because your mental health has a huge impact on your physical health. The two go hand in hand.
Yes, it does.
Having a disease, having a physical problem, you can end up depressed, and the other way around. If you're depressed, it's going to cause you other difficulties. But one of the things I wanted to say, Dr. Dorio, is that for anybody that's thinking, I don't want to be locked up in someplace, I'm not going to go anywhere where they might do that, we are a short-term facility. We are there for an acute mental health crisis. That's what we're there for. So no one is going to come live with us. No one is going to be locked up for an extended period of time. That's just not what we're there for.
Yes, they will get the initial treatment and then be referred.
That's right.
To someone who they can go to continue that treatment.
And while they're there, they'll see therapists.
Right.
And they'll even have fun. We have activity therapists there. They bowl. They do all kinds of things. We don't have a bowling alley. We either do it in the hallway or we have one of those Wii systems where you can do it on the monitor. Yeah, it's a lot of fun.
But don't be fearful. Don't think for 1 second that in our community, Santa Clarita, that help is not nearby, because it is.
It sure is.
And we just don't want in our seniors to be facing these ongoing problems. We see bad things all the time on television, hear it on the radio, blah, 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 blah. We don't, it affects us emotionally. And, when we are down, there are resources in our community to bring you back up again.
That's
so.
Right.
Please don't ignore it. The senior center is another viable option. The hospital is another viable option. We've been looking at this for years to help those who are in need out in our community. So please don't hesitate and don't be fearful.
And don't self-medicate. Don't use alcohol or some other drug that you find, because that is just going to get you in a lot of serious trouble.
I can relate to that, believe me. When I lost my son, I had also gotten a divorce and had 3 children to raise and 3 children to take care of. And when I lost Chuck, I thought, and I started drinking. And all of a sudden, I woke up in the middle of the night one night, and I'm thinking, what are you doing, Barbara? What are you doing to yourself and the rest of your family? I thought, Chuck lived a life with more exuberance than most people do in a lifetime. What am I doing feeling sorry for me when I have the rest of the family to take care of? I have me to take care of. And I got myself into therapy really quick. And it was the best thing I ever did. Absolutely the best thing.
Well, as Dr. Dorio knows, over 50% of the people that we have in our behavioral health unit on any given day also have a chemical dependency problem. They've either been using alcohol or they've been using drugs to self-medicate themselves to feel better. So now, not only do they have to take care of their mental health issues, but now they have to see somebody about getting over the alcohol and drugs.
That's right.
Don't want to go there.
No. And I'm so thankful I did what I did, because it saved my life and my family's life.
I just have to say, if you're a senior and you're out there listening, I got to tell you something. Don't let anybody in the world, and I mean anybody, tell you that you don't have something to contribute to this world. You have a lot of knowledge and a lot of wisdom, and
Absolutely.
we need it.
Absolutely.
Great
share it.
information, Mike. Great advice for our seniors who are listening. Once again, Mike, you're a part of Henry Mayo Hospital. You're a part of this community, a part of the behavioral health unit, giving some super advice to our listeners out there. Thanks so much for being on the show today.
My pleasure. Thank you.
Yes, and come back soon to see us.
I understand I'm going to be back in November.
Yes.
That's
yes.
pretty soon.
And see if you can find some more funny quotes.
Not a problem.
Just make sure they're not mine.
There you go.
We are sponsored by Advanced Audiology and SCV in-home care. Listen to us next week on the Senior Hour. Now go and enhance your quality of life.
You worry because your mom and dad aren't as active